This is Chapter 8 out of your ADA book, Patient Clinical Records. So in this lecture, we're going to talk about the clinical record and some of our guidelines for keeping those records. The clinical record is a way to communicate information about the patient's financial responsibility, medical history, and dental needs. The clinical record is going to serve as a legal document. The key elements of record keeping include organization, consistency, and completeness. The clinical record accessibility is twofold. So we want the dental healthcare team to be able to find clinical records and the information needed, but also the patients have a right to view their clinical record. Our systems include paper-based. So this is where we have specific forms that are completed by hand and then organized in a paper file and stored in a manual filing system. Then we also practice electronics record keeping. We're using the same information, but we're capturing and storing it in a different way. This has really expanded over the years and is now the primary tool used in electronic healthcare. Electronic clinical records organize and maintain business and clinical records, store patient clinical and financial information, track and electronically transfer insurance information. They also can serve as a recall system, scheduling appointments, record clinical findings, access online services, communicate with the patients, the healthcare team, and also professional organizations. Components of the patient clinical record include manual or paper record, electronic record, or a combination. Components of a complete clinical record will include the patient's health history, dental history, personal and financial information, vital and diagnostic signs, TMJ evaluation, oral cancer screening, periodontal evaluation, all the radiographs, models, diagnostic test findings and exam notes, diagnosis and treatment plan, progress notes, prescription information, laboratory prescription information, notes objectively describing complaints or confrontations, notes about rescheduled, missed, or canceled appointments, information consent, all written authorizations, and any correspondence to and from the patient. Suggested forms in a paper-based record-keeping system would include an individual patient file folder, your dental radiographs, acknowledgement of receipt of privacy practices, the initial registration form, dental history form, medical history form, recall examination form, clinical examination form, periodontal screening examination form, patient treatment form, problem priority list, progress notes, consent forms, lab prescriptions, a signature on file, financial agreement, correspondence log, and telephone information. Other forms could include patient acknowledgement and authorizations, privacy practice notice, registration forms, other diagnostic records, diagnostic models, and patient consultation. Patient authorization is a section of the form where the patient signs to affirm that the information he or she provided is correct. If a dental practice is going to communicate via a patient's cell phone, then the practice must obtain permission from that patient. Patient responsibilities documents contain a brief statement about the goals of the dental practice to help patients achieve optimal oral health and then the patient's financial and scheduling responsibilities. Privacy practices notice and registration form. 3 communication documents given to a patient to describe how health information may be used. We'll have the notice of privacy practices, the instructions for our notice of privacy practices, and acknowledgement of receipt of notice of privacy practices. Other diagnostic records could include x-rays, digital radiographs, periodontal evaluations, and intraoral photographs. Diagnostic models may also be included. These include the cast of the patient's mouth, but these will typically be stored in a cabinet or box. The patient consultation is a discussion between the dentist and the patient that's going to outline the patient's dental condition and what treatment is being recommended. Information consent forms serve as documentation of the recommended treatment, the risks and the benefits of the treatment, the likelihood of success, if there are alternative options and what they are, and the option of no treatment. A new patient may collect dental office for an appointment in different ways. Each type of media may require a slightly different response from the dental healthcare team. To ensure consistency, a protocol for collection of information for each method must be established and followed. Clinical records risk management identifies conditions that could inspire malpractice suits, subpar communication, or dental healthcare team relationships, bad record keeping, incomplete patient files, or non-compliant procedures. Dental healthcare team limits risks by identifying and correcting poor conditions, staying informed with the statutes, regulations, and mandates, and consulting third parties to identify and solve problems. Tasks of the clinical record risk management would include entries, patient identification, providing consistent information, statements, progress notes, correspondence, telephone conversations, missed appointments, failure to follow instructions, prescriptions, and the rationale.